Hello and welcome to Healing Hands Nursing. In this video, we're diving into cholecystectomy, one of the most common general surgeries you'll see on the floor. We'll cover key points for nurses, focusing on pre-op and post-op care, as well as the differences between laparoscopic and open approaches. Whether you're a new nurse or just need a quick refresher, this video is for you. Cholecystectomy is a surgical procedure performed to remove the gallbladder. It is commonly done to treat gallstones that cause pain or infections, and other conditions such as inflammation of the gallbladder, cholecystitis. Gallstones can block the flow of bile from the gallbladder, leading to pain, inflammation, and infection. Removing the gallbladder can help prevent future complications related to these conditions. Let's start by reviewing the two main types of cholecystectomy procedures. Laparoscopic cholecystectomy is the most common approach. Nurses should be familiar with how minimally invasive surgeries impact patient care. With just a few small incisions, patients generally experience less pain and quicker recovery times. One common issue is pain caused by the gas, carbon dioxide, used during surgery to inflate the abdomen, which can cause shoulder pain as it irritates the diaphragm. As nurses, we'll focus on managing smaller wounds, addressing pain from the gas, less invasive pain management, and encouraging early movement. Open cholecystectomy is used when laparoscopic isn't an option or if complications arise. The larger incision means a longer recovery time and potentially more pain for the patient, so pain management and wound care become more intensive. We'll discuss the key nursing interventions for both approaches in the post-op section. Pre-op care for nurses. As nurses, it's crucial to ensure patients are well prepared for surgery. Here's what to keep in mind. Verify that the patient has not eaten or had anything to drink for at least 8 hours before surgery to prevent complications during anesthesia. Double-check that all required tests, like blood work, electrolytes, and liver function tests, are completed. Ensure that any imaging, like ultrasounds or CT scans, is available in the patient's chart. Ensure that all surgical consents are signed, and verify if the patient has any known allergies, especially to medications or anesthesia. Although surgeons usually explain the procedure, it's important to reinforce post-op expectations, like the importance of early movement and wound care. Answer any last-minute questions patients might have to ease their anxiety. Teach patients techniques for deep breathing and encourage using an incentive spirometer. This will help prevent respiratory complications after anesthesia. After the procedure, patients who undergo laparoscopic surgery may only need mild pain medications, such as over-the-counter pain relievers. It's important to also address pain caused by the gas used during surgery, which can lead to discomfort in the abdomen and shoulders. Suggest using a small pillow under the abdomen while lying down to help reduce pressure on the diaphragm. Encourage patients to begin walking as soon as possible to prevent complications such as blood clots. Early movement also helps alleviate discomfort from residual gas. Typically, patients should start walking within a few hours after surgery. Monitor the small incisions for signs of infection, such as redness, swelling, or drainage. Educate patients on how to keep the incision sites clean and dry, and instruct them to report any signs of infection immediately. Patients are usually started on clear liquids and then slowly advance to regular diets. Monitor for signs of intolerance, such as nausea or bloating, and advise patients to avoid high-fat foods after surgery. Patients can generally return to light activities within a few days and resume regular activities in about 2 weeks. Remind them to avoid lifting heavy objects, more than 10 to 15 pounds, for at least 2 weeks to allow proper healing. For patients who undergo open surgery, stronger medications, such as opioids, may be necessary for pain management. Encourage these patients to walk as soon as they can to prevent complications like blood clots. Patients should typically begin walking within a few hours after surgery. The larger incision from open surgery requires more intensive care, including monitoring drainage and ensuring the wound is healing properly. Educate patients on keeping the incision site clean and dry, and to report any signs of infection immediately. As with laparoscopic surgery, patients typically start on clear liquids and gradually progress to a regular diet. Watch for signs of intolerance, such as nausea or bloating, and advise patients to avoid high-fat foods after surgery. Full recovery for open surgery may take 4 to 6 weeks, and patients should avoid heavy lifting during this time. Encourage them to gradually increase their activity levels, but to listen to their body and avoid overexertion. Finally, educate patients on recognizing signs of complications such as infection, bile leaks, or worsening pain, and advise them to contact their healthcare provider if any of these issues arise. As nurses, understanding the key differences between laparoscopic and open cholecystectomy is essential for providing the best care. Whether it's managing pain, promoting mobility, or educating patients on their recovery, our role is critical in ensuring they recover safely. Don't forget to subscribe for more expert insights on surgical care and other medical procedures. Thanks for watching Healing Hands Nursing, and I'll see you in the next video.